The financial life of someone with ADHD can be chaotic. We have an idea of how much we earn, but what about how much we spend? It's quite common to be surprised by the credit card bill or to make unnecessary impulse purchases. But there are tools that help me bring order to this chaos, and I teach all of them in the first link in the description.
Hello everyone, I'm Yuri Maya from the channel ADHD Simplified, and today my video is about what to do to get an ADHD diagnosis. Many people reach out to me in my message box, in the comments on Facebook, on YouTube, how should the ADHD diagnosis procedure be done? Because there is a lot of disagreement about what one professional and another are doing in hospitals and clinics. So, I decided to make a video to address the main questions I've been receiving. I'm not going to go into details about how the tests are conducted and what the characteristics of ADHD are. The purpose of the video is to show people what the necessary procedures are to obtain the most accurate possible diagnosis regarding ADHD. Which professional can perform the diagnosis? Officially, doctors, specialists who can make the diagnosis are neurologists or psychiatrists. If you suspect you have ADHD or if you have a child with that suspicion, take them to one of these two specialists. In addition to the doctor, it's ideal to have an interdisciplinary team throughout the entire process. This team will conduct an assessment together with the doctor. In other words, in addition to the initial assessment, the child will need to see a psychologist and a speech therapist. And based on the results of these assessments, everything is sent to the doctor, who then, at their discretion, closes the diagnosis. What is the minimum age for an ADHD diagnosis? There is no minimum age. Officially established, however, according to the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, in its 5th and latest edition, it states that, up to the age of 4, any excessive activity, motor activity exhibited by the child can easily be mistaken for normal behavior. What becomes difficult to distinguish? Because this behavior is highly variable until the age of 4. But for Dr. Russell Barkley, who is a world-renowned specialist doctor from the United States known for his studies, regarding ADHD, it is stated that the symptoms become more evident and easier to identify at the beginning of elementary school. Therefore, from the age of 7, there's a lot of discussion about a minimum age for diagnosis, which is absolutely normal. Because the younger the child, the harder it is to identify. The assessment of certain behavior can be seen as abnormal, but in fact it isn't. Also, at this point, it's important to remember that one of the key factors that determines whether the child has it or not, ADHD. It's the presentation of a series of symptoms that should be observed in this child over a minimum period of 6 months. For many researchers, the desired time frame is at least 12 months. And these symptoms must appear in more than one environment, such as, for example, at school and at home. So, when it comes to children aged 2, 3, or 4, it becomes more difficult to make this kind of observation. Then comes the question, is it possible for ADHD to be identified before the age of 7? Yes, it is possible. The fact that there is a higher probability of a false positive doesn't mean that it will happen. However, we can conclude that it is safer to conduct an interdisciplinary diagnosis starting from the age of 7. What tests are necessary for a more accurate diagnosis? In children, the anamnesis with the parents. What does that mean? It means a detailed interview with the parents. The doctor may ask specific facts about the child, relevant behaviors that they have been exhibiting. All of this is to help with the diagnosis. The child's symptoms will be observed, focusing on the duration and persistence of the observed event. Psychological and behavioral tests will be conducted. Persistence of the observed event, that is, at what moment the child is exhibiting the behavior and how consistent it is over the months and years. With the psychologist, psychological tests will be conducted in addition to the behavioral assessment. The psychologist may go to the child's school to talk to the teachers. With the principal, for example, the doctor may also request a specific report made by the school psychologist, which will detail the behaviors of that child in the classroom. With the audiologist, the P300 test can be performed, which measures the patient's auditory potential. This test helps to identify a person's cognitive function, that is, their ability to learn, memorize, and process sound information. And, in the case of adults, the only thing that changes is that the anamnesis is conducted with the adult themselves. However, family members can also be involved, like the mother and father, because they are the ones who remember the person's childhood better. There are adults who don't remember their childhood. It feels like an eraser has gone over it. That's not the case for me. I really remember my childhood very well. And finally, with the completion of the exams and reports, the specialist doctor makes the diagnosis and starts the treatment, which can usually involve medication along with psychological support. Then comes one of the biggest questions too. What is the importance of all these exams for a good diagnosis? There are pathologies or disorders that are often confused with ADHD. The idea of conducting a thorough and interdisciplinary examination is to minimize the risks of this error, because if a person receives an incorrect diagnosis, they will receive incorrect treatment, and your problem will never get resolved. One of the common pathologies. What is completely confused with ADHD is DPAC, which is Central Auditory Processing Disorder, which is the individual's difficulty in processing and storing auditory information. The person hears perfectly but can't interpret what comes into their ear properly. That's why many times DPAC is confused with ADHD. There are other disorders. Also, there's dyslexia, which is the difficulty an individual has in recognizing and differentiating letters and words. And there's dyscalculia, which is the difficulty an individual has in dealing with mathematical concepts. Operations, signs, numbers, mental math, but at the same time, the person shows normal performance in other areas. According to neuropsychologist Sylvia Siaska, nowadays, the diagnosis for identifying ADHD is one of the most rigorous in the world scientifically. And generally, this analysis requires time, patience, knowledge, and engagement from the interdisciplinary team. Everything is aimed at ensuring that the person gets the correct diagnosis without labeling, because these are comorbidities. And what are the most common ones? According to Barkley, ADHD rarely presents itself in isolation, meaning just ADHD and nothing else. In 87% of cases, ADHD is associated with other pathologies, and the term comorbidity refers to this association between one or more pathologies. And some of the disorders associated with ADHD are ODD, oppositional defiant disorder, CD, conduct disorder, and learning disorder, and so on. And generally, if the diagnosis was made rigorously, by following the steps, it's possible to identify not only ADHD, but also the presence of its comorbidities, which greatly facilitates treatment. The goal of this video is to increase the chances of an accurate diagnosis. I listed practically all the procedures described in medical literature and in the DSM-5. If your doctor has skipped any of these steps, it doesn't mean their diagnosis is incorrect. Of course, there are specialists with a clinical eye and enough experience to make a very accurate diagnosis, as well as psychologists who also have this ability when analyzing the patient. So the purpose of this guide is to provide a path for those people who are still undiagnosed and want some guidance, how to do it, or those people who are unsure about the diagnosis that was presented. An important tip I would like to give in this video is about university hospitals. Many people struggle to find good professionals. They usually charge a lot and don't accept health insurance, which ends up weighing heavily on the budget, especially for the diagnosis, which requires tests and an interdisciplinary team with several consultations. In university hospitals, you can also find great specialists, usually with a shorter waiting time than the SUS. So, look for the nearest hospital to you. And if you want to know more exclusive tips about ADHD, I'm going to leave a link in the description of this video. You will click and then enter your email there. This way, you'll receive tips right away, plus you'll always be updated on what's happening on the channel. I hope you liked the video. Don't forget to like, share, and follow the Facebook and YouTube page as well. Thank you very much, and until next time.
There, ADHD. Imagine living in healthy relationships, with greater acceptance among you, without fights over forgetfulness, poor communication, or lack of organization. You can learn all of this in the club. ADHD in Action, the toolbox for ADHD. Check it out in the first link in the description.